Many people think that losing weight and reaching their goal weight feels like winning the lottery. I'm Dr. Gordon, board certified in obesity medicine. I hold a coaching certification and have worked with hundreds of women through significant body transformations. But before we go any further, I'm a physician, I'm not a psychologist. What follows is the current evidence on identity change during obesity treatment combined with what I've observed across years of clinical practice. If you're struggling with any of this, a therapist who specializes in this area is the right next step. The lottery winner assumption makes sense. You've worked hard, you've lost the weight. The thing you believed would change everything has finally happened. A landmark 1978 study found that lottery winners were not significantly happier than controls. They derived less pleasure from ordinary daily events. The peak experience of winning diminished the enjoyment of everything else. The research on significant weight loss shows a similar pattern. Body image scores peak at around 12 months after treatment and then gradually decline. A population-based study of adults over 50 found weight loss associated with a 289% increase in depressed mood despite clear physical health benefits. Becoming thin, like becoming rich, changes your circumstances. Who you are takes longer to catch up. When you lose significant weight, your body changes faster than your self-concept. The literature calls this the identity lag. Your body is in one place, your sense of self is still in another. You look in the mirror and the person looking back is unfamiliar. You reach for clothes that no longer fit, you catch your reflection and stop. This is neurobiology. The brain builds a body schema over years, and that schema updates slowly, much more slowly than the scale moves. Studies show that up to 74% of people with overweight or obesity have body image distortion or dissatisfaction before treatment. After significant weight loss, a meaningful percentage continue to perceive themselves as larger than they actually are. The clinical literature has a name for it, ghost fat. You lose the weight, the ghost stays. The research on women's experience is striking. Before significant weight loss, many women with obesity describe feeling invisible, ignored in professional settings, passed over socially, treated as though the space they occupy belongs to someone else. Perceived weight discrimination affects approximately 42% of adults with class 2 obesity or higher, with higher rates reported by women. Class 2 obesity is a BMI of 35 to 39.9. It's also the threshold above which discrimination becomes significantly more prevalent and significantly more damaging. Approximately 40% to 50% of adults with overweight or obesity internalize that discrimination. They turn the stigma inward. They come to believe at some level that the treatment they receive reflects their value. Then the weight comes off, the social treatment shifts dramatically. People who ignored you in the past make eye contact. People who dismissed you listen. Strangers hold doors, colleagues consult you, a romantic attention arrives where it was absent before. And instead of relief, many women feel something closer to rage. Because if you were treated as a full human being now, what was the last decade? And what does that reveal about the people who treated you that way? What does it say about the years spent accepting less? Qualitative research describes women entering a period of constant internal and external vigilance, watching how people respond to them, cataloging the difference, trying to reconcile the years of one experience with a completely different present. Some women describe anger where they expected freedom, and that anger is a reasonable response to a social environment that assigns value based on size. It's also disorienting when the expectation was relief. This mirrors the lottery winner experience. Norwegian lottery winners reported a frequent wish for anonymity and fear of envy from others. Post-bariatric patients report concealing their surgery and feeling conflicted about the superficiality of their new social acceptance. The social treatment changed, the trust in people took longer. The bias women with obesity experience extends into the healthcare system with specific, measurable consequences. Men experience this too. A meta-analysis of 41 studies confirmed that healthcare professionals demonstrate moderate implicit weight bias toward patients with obesity, regardless of sex. But the data on women is particularly stark. 69% of doctors report biased attitudes towards people with obesity. Healthcare professionals describe these patients as lazy, non-compliant, and lacking willpower. These are the people charged with their care. Physicians spend less time in appointments with patients who are obese. They provide less health education. They report less desire to help. 83% report reluctance to perform examinations on women with obesity. 68% of the heaviest women report delaying healthcare entirely because of disrespectful treatment, because the equipment is too small for their bodies, because the experience of seeking care had become a source of harm in itself. The clinical consequence is documented and has a name: diagnostic overshadowing. Symptoms attributed to weight when they're caused by something else entirely. knee pain, fatigue, shortness of breath. Real conditions get dismissed. Workups get skipped. Patients are told to lose weight and come back. After significant weight loss, these same complaints may suddenly receive a full clinical workup. The same patient, the same symptoms, a different body, a different standard of care. That shift is real. It is evidence of systemic bias. Recognizing it for what it is rather than absorbing it as a personal failure on your part is part of the identity work that weight loss requires. Data from 2 large Swedish cohorts showed something that almost never appears in conversations about the benefits of weight loss. Significant weight loss is associated with both an increased rate of new relationships and an increased rate of divorce and separation. The same treatment that opens new social possibilities destabilizes existing ones. Partners sometimes feel jealous, threatened, left behind. The dynamic they knew has shifted in ways they didn't anticipate. Pre-existing poor family relationships are the strongest predictor of post-treatment separation. Women who lose significant weight sometimes discover that the relationships they had were built around a version of themselves that no longer exists. The lottery winner parallel holds here as well. Research on lottery participation found that higher lottery spending was associated with a poorer social functioning and lower frequency of social support, suggesting that the pursuit of windfalls disrupts the networks it was supposed to enhance. This is a predictable pattern, and knowing it's coming will allow you to prepare for it. The before and after photograph captures a physical change. The research shows what the photograph misses. People who were once obese and have since lost the weight are still stigmatized more than people who were never heavy to begin with. Social acceptance is real and incomplete. Internalized weight bias does not reliably decrease with weight loss. One study found that losing weight didn't change how people felt about themselves internally. The internal critic outlasts the external weight. Women who spent years with a particular self-concept carry that self-concept into a smaller body. The body changes, the belief system changes more slowly. Years of stigma leave a residue that thinness alone cannot clean up. That is exactly why the research on psychological support during this transition matters. The research identifies several evidence-based approaches, and I want to walk through the ones I think matter most. Before treatment begins, knowing this disruption is coming reduces the shock. Knowing what to expect before you start treatment is guideline recommended. Your physician should be having this conversation with you before you begin treatment. Cognitive behavioral therapy has the strongest evidence base for improving eating behavior, depression, anxiety, and quality of life during and after significant weight loss. Start early before the problematic patterns begin. The Weight Bias Internalization and Stigma program is a cognitive behavioral intervention specifically designed to reduce internalized weight stigma. 2 randomized controlled trials showed it produced greater reductions in self-devaluation and improved coping with stigma compared to behavioral weight loss alone. Body functionality training shifts your attention from how your body looks to what your body can do. A randomized controlled trial in post-bariatric women showed improved body appreciation that held at follow-up. Acceptance and commitment therapy builds psychological flexibility. Learning to accept uncomfortable internal experiences while staying committed to what matters to you. Multiple randomized controlled trials confirm it works for weight-related difficulties and internalized weight stigma. Exercise protects your mental health during this transition in ways that have nothing to do with its effects on your body. A randomized controlled trial found that adding exercise to caloric restriction produced significantly greater improvements in depression and anxiety at 12 months than restriction alone. The lottery winner study became the most famous demonstration of a concept called hedonic adaptation. Humans return to a baseline level of happiness after any major life event because circumstances change faster than identity. According to the hedonic adaptation research that followed, the antidote is 2 things: sustained appreciation of what changed and staying engaged with what the change makes possible, rather than chasing the next threshold. For women in obesity treatment, that translates directly. Build your self-concept around what your body can do, who you are in your relationships, and what you value. The women who do best after significant weight loss are the ones who stop measuring their progress against a number. The body changes first, the identity follows. The work is closing the gap. Follow me for obesity medicine grounded in physiology, not blame.